Today, the state made it clear that Michigan's numbers are now trending in the wrong direction.
Now, a closer look at who is getting infected does suggest the vaccines are making an impact. Dr. Frank George has been digging through the data and joins us with what we need to know. Frank?
Yeah, today's data review by the MDHHS actually reflects the race between rising cases and the push to get vaccines in arms, all after Michigan recently loosened many COVID restrictions. Tonight, health officials are stressing this pandemic is not over yet.
Let's start by focusing on the left side of this graphic, showing statewide trends in the key progress indicators of percent positivity, daily cases per million, and the daily hospitalization rate in the past 3 months. Percent positivity was declining, but it's gradually increased to 5.1%, again above the goal of 3 to 5%. Daily cases per million were also on a decline, but are now trending up. And lastly, the previous fall in hospitalizations has leveled off and also begun to increase. The changes aren't alarming, but they're definitely not in the right direction. Now, looking at new cases by the age group affected, there's some important information. New cases in seniors over 70 have remained nearly flat, possibly related to vaccination efforts. The greatest increase is in new cases among people under 50. Now, along that line, this is a chart looking at the number of new outbreak investigations by site type. You can see at the top, the leading location is K through 12 schools. And on this graphic, you can see high schools are the leading source for these school outbreaks. On the vaccine front, Michigan is making good progress. Roughly 60% of people over 65 have been vaccinated with at least one dose. Roughly 25% of the eligible population has received at least one dose. And 1 million residents are completely vaccinated.
Now, in terms of new daily cases, those between age 10 and 19 currently have the highest case rate, and they are increasing faster than any other age group. Overall, at the rate we are currently growing, we would double our number of hospitalized cases in approximately 5 weeks.
There's a lot there to chew on. Fascinating. Now, this is playing out, though, Doc, as these new variants are spreading in the state, and that has a different kind of impact, right?
Yeah, Devin, the variants are definitely kind of a wild card in all of this. And coming up at 6, I'm going to take a closer look at why Michigan has so many more confirmed cases of variant strains compared to other states, and how that could honestly affect our ability to fight this moving forward.
You got it right, Frank. We'll see you at 6 o'clock.